My name is Dr. Michael Pimienta. I'm a triple board certified physician and gastroenterologist here at PIH Health. I grew up with a single mother who was a housekeeper, and one of the families that she worked for a long time, her boss was a physician. Once I got to the time I was in high school, he really suggested to me, because I looked up to him, why don't you think about medicine as a career? And so I would say since that time, he pretty much took me under his wing. My interest in gastroenterology started in college. There was a physician scientist over at UC San Diego. His name was Akihiro Seki, and he mainly studied liver diseases as well as digestive diseases, and he was the first person to take me onto their lab. Obviously, as a college student, you have a lot going on with classes, but this person really dedicated a lot of time to mentorship of me. So I went to medical school at my alma mater, but in the back of my mind, GI was always there. So I applied to internal medicine residency with the goal of becoming a gastroenterologist. And from there, I went to residency in internal medicine at the University of Southern California at the LAC USC Hospital in downtown LA. I did my fellowship at Stanford University. I encompass anywhere from the esophagus, which is the food pipe, down to the stomach, small intestine, throughout the rest of the digestive tract, which would be the colon as well. We also focus on other parts of the digestive system, which include the pancreas as well as the liver. Not everything in medicine is black and white. You have to have a little bit of creativity in what you do, and you have to think outside of the box. I think one of the things that probably makes me a good physician is I'm a pretty social person, and I think it takes a good amount of being able to listen to your patient. You listen to the patient to not only identify what's the clinical issue, but how it's affecting them on a day-to-day life, and meet them where they want to be met. I'm often not there to tell you what to do, but rather to try to educate you and help you understand your own illness or your own symptoms, and how we can make sure that you get better, you feel better, you have a better quality of life, and that we get to the bottom of it. Seeing patients day to day in the clinic or at the hospital at their lowest, and often, as I hope, at their best part once their illness is managed or cured, is really what brings me my joy. I think I'm lucky to live in Southern California in terms of being able to enjoy life outside of medicine. So I spend a lot of time on my bike. I like to spend a lot of time at the beach. I particularly like snorkeling. Haven't really gotten into scuba diving yet, but at some point perhaps I will. And I really enjoy cooking. I think most important for me for my mental health is really spending time with family and friends, being able to spend time with my mom. And now that I'm a physician, being able to at least show her and allow her to explore part of the world that I'm able to explore. I can't imagine a day where seeing patients, treating illnesses, doing procedures is not a part of my weekly routine. Here at PIH Health, we focus on patients and not just their illness, but really how their illness is affecting their quality of life. It's extremely gratifying, but it's just fun.